Hello, my name is Isabella Eiler, and I'll be discussing my research that looked at the impact of social determinants of health on Riley NeuroNICU infant follow-up. We wanted to look at socioeconomic determinants of health, which are said to contribute up to 40% of long-term health outcomes, in order to determine the effect they have on follow-up of the vulnerable population of infants admitted to our NeuroNICU. The main objectives of our study were to first determine association of socioeconomic determinants of health with attrition rate of NICU graduates at first NeuroNICU clinic follow-up, and second, to develop spatial associations with attrition at follow-up using driving distance and time from Indiana University Health. We performed a retrospective cohort study of NeuroNICU infants admitted from November of 2013 to March of 2020. We screened 1,309 infants, with 173 of them dying prior to discharge. Follow-up data was collected for 1,001 infants, and follow-up was scheduled in our NeuroNICU follow-up clinic for 565 infants. We had a show of 454 and a no-show group of 111. We gathered information regarding maternal characteristics, infant characteristics, and follow-up data. We found significance in marital status, educational status, insurance type, as well as distance to clinic in miles and minutes. Our attrition rate at first NeuroNICU follow-up was 19.6%. Figures 2 and 3 demonstrate the increasing attrition percentage as miles and minutes increase from clinic. Attrition prediction models were developed. In Model A, adjusts for gestational age, respiratory support, and feeding status at discharge. Models B and C include different social determinants of health. Model B, which included maternal education and health insurance, was the best predictive model. Model C, which included additional factors of marital status, driving distance and time, employment status, and zip code-based median household income, did not improve predictions. In conclusion, our study was the first of the NeuroNICU population to explore the impact of socioeconomic determinants of health on attrition at first NeuroNICU clinic follow-up visit. Driving distance and time were positively associated with attrition risk. Patients in the no-show group were more likely to have public insurance, lower zip code-associated annual household incomes, live a greater distance from the clinic, and be born to single mothers and those of lower educational attainment. Model B was adjusted for gestational age, respiratory support at discharge, and feeding at discharge, as well as including the socioeconomic determinants of health for maternal education and health insurance, was the best predictive model for attrition risk. Knowledge gained will be used to improve our clinic operations as well as access to NeuroNICU outpatient services. Our next steps will be including creation of a spatial heat map of the IU Health NeuroNICU population, stratified by attrition risk, in order to advocate for this vulnerable population.